Late Life is a production of Twin Cities Public Television in partnership with Allina Health, whose Lifecourse project, funded by the Robina Foundation, granted the producers unique access to their ongoing research into late life care in Minnesota.
I know where that's going.
Minnesotans are getting healthier but older. Many of us will reach a period of late life when death is within 3 years, but not imminent. From watching earlier generations, many of us have come to dread late life. What conversations should we have with our family members and caregivers, and when? What questions should we ask?
I was having a heck of a time getting my breath, but that went away.
Amongst the challenges we face is our uneasiness about healthcare choices in these later years and our uncertainty about how these will affect our family, our beliefs, and our legacy.
You managing to get your exercise in?
Yes, I've started back.
With limited resources and time, care is often delivered in a way that feels impersonal and disconnected from what matters most to the individual and their family. Is there a way to be cared for that respects what matters most to us as people? We believe that when healthcare systems and communities tend to both medical and non-medical needs, patients and families experience better outcomes of care.
My main goal is to function as well as I am. I will be happy with that.
Lifecourse is an approach at Allina that delivers supportive care focused on what matters most to the patient. It relies on specially trained care guides to meet monthly with people, usually in their homes.
Volunteering is a very important part of my life.
At its most basic level, Lifecourse is proving that understanding individuals' whole person needs over time improves their care experience.
Right there.
Yes, ma'am. Who is that?
That's me.
That's you. You a very pretty lady.
To date, those involved with Lifecourse have avoided unnecessary care and hospitalizations as they set a path based on what matters most to them. The dialogue around healthcare in late life is core to many organizations.
We talk about goals of care, so discussing their wishes, their hopes for their future, making sure their medical care is always in line with what they want, and also making sure that they understand what all their options are.
We would like to hear from others involved in this work, bringing together a set of engaged leaders representing organizations across community, faith, healthcare, and government sectors.
Yep, this is the burning bush.
The past 2 years, we have worked with partners to get the public thinking about late life, with the expectation that collectively we can raise the bar on improving the quality of the late life experience for aging Minnesotans, their families, and the entire community. Late Life is a production of Twin Cities Public Television in partnership with Allina Health, whose Lifecourse project, funded by the Robina Foundation, granted the producers unique access to their ongoing research into late life care in Minnesota.